Righto, everyone right to go?
The Victorian Premier's first day back on the job.
We wish our colleagues in New South Wales all the best, and we're there to help. If there's anything we can do, we're more than happy to do that.
As the Delta variant continues its spread,
18 cases of community transmission.
Cities are reimposing restrictions.
I really want Queenslanders to start wearing these masks again.
We will be putting an upper limit on private gatherings.
We need to extend the lockdown for a further 72 hours.
And border controls are tightening.
This is the first time that Victoria has had orange and red zones in most Australian states and territories.
All eyes turned to Canberra as the PM met with premiers and chief ministers at another
emergency national cabinet meeting.
On the agenda, day 16 post-quarantine testing, a ban on low-risk travellers quarantining near high-risk travellers, and mandatory vaccinations for aged care staff. But the lockdown-weary leaders all had the same subject top of mind.
I'll raise the issue of more vaccine supply.
The vaccine rollout is imperative.
Lockdowns and restrictions are not a long-term solution. Vaccination is.
You have to plan for the future. You have to plan for the weeks and months ahead. And I'm getting frustrated that people aren't doing that at other levels.
But until September, when around 30 million doses of Pfizer and Moderna begin to flood in, as much as we hate them, Australians might need to learn to live with lockdowns.
Epidemiologist Professor Tony Blakely joins us once again. So, Tony, any way you cut this, it's a few months before we get the vaccines the premiers are calling for, and even if we had them now, we'd probably still be in lockdown currently. Do we just have to accept lockdowns as an inevitable way of life until the vaccine really has rolled out fully?
Yes, we do. We don't want to reach into that toolkit all the time and pull it out, but it is there when we need to, as New South Wales has demonstrated. Once the vaccine coverage gets up to, say, 40, 50% or so, the need for lockdowns will diminish. But until we get to that point, with these Delta variants, we will need lockdowns from time to time when things don't go our way.
Tony, given how this has spread from Sydney, is it possible that we're on the verge of another national lockdown?
I sincerely hope not, and I don't think so. Whilst it looks messy when you think about all the things happening across the states and territories, it is pretty well localised in most places other than in Sydney. So I don't think we're heading that way. It's good to see lots of states and territories making masks mandatory in various places and those sorts of measures. I think we'll be okay.
Professor, it's being reported that that National Cabinet meeting, which is about to break up, looked at things like changes to quarantine and also to mandatory vaccination for aged care staff. Both of those things would have an impact, wouldn't they?
They certainly would, and it's oh so frustrating to be standing here talking about it. We were talking about this stuff 8 months ago. So whilst you can't require somebody to be vaccinated, I believe a workplace such as aged care, health sector, border control can at least require that their workers are vaccinated. And I'm surprised it's taken us this long to get to that point. Also, as far as the vaccination coverage in aged care, from what I understand, it's sitting at about a third. That's appalling. That needs to go up a long way. So we actually have a lot of things to improve here.
We should be clear, Tony, the third is for staff, not for residents. So residents seem to be mostly vaccinated.
Correct, for staff, yes.
It's staff.
Yeah, thank you.
Yeah.
Yep.
Sorry, Pete.
Tony, every new case shows us how transmissible the Delta variant is. I mean, can lockdowns realistically keep it under control? Is there a chance it's just unstoppable?
It's a really good question. We've been doing a lot of work in our models on this, and there's one, the reproductive rate you've got to get less than to control it. So far, lockdowns get us beneath that, but it may get to a point where lockdowns is not quite enough and we need a bit of vaccination, universal mask wearing and all that sort of stuff. But at the moment, for the Delta variant, which infects, one person infects 5 in pre-COVID situations, lockdowns can do it. And they're very effective because we're all staying in our homes and we're not getting out and about much. So far, okay, lockdowns are still a good solution when we need it.
Given everyone is so worried about levels of vaccination, do you think, Tony, there's a case for making AstraZeneca, which we have heaps of and we can make, available to anyone who wants it? So not forcing it on anyone, obviously, anything like that, but there are a whole lot of young people, all kinds of age groups, who right now would take an AstraZeneca jab if you offered to them and they just can't get their hands on it. Is that something we could do right now or should do right now?
Yes, I agree with you, Waleed. I think that for people who understand the risk and are prepared to take that very small risk and get vaccinated, let's use our AstraZeneca up. We're, treading in the paddling pool here, waiting for Pfizer and Moderna that's not starting till October in serious volumes. The more people we can get vaccinated with AstraZeneca now, the more resilient we are. Here I am, I'm about to have my second AstraZeneca dose. Younger people, if they did the same, we'd still need an mRNA vaccine next year to boost us up, but we're going to be looking at annual boosters anyway. So yeah, I'm all for it. For people who want to get the AstraZeneca, go get it.
Tony, always good to speak to you. Thank you so much for your time again tonight.
Pleasure. Hope that was useful.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.